Why are you lined up so early this morning?
So the wait times are ridiculous. So if we come after, say, 9 or 10, then you're looking at like a 5-hour wait. And my dad's sick, so it's easier for me to come pour him in line and he just comes see the doctors and he's already in the waiting list.
So you're here on behalf of your dad?
I'm here on behalf of my dad. I mean, the doctors are for our kids, for our people, for our families. So it's one of the major things that need to be reconsidered, especially the wait times. And I mean, we have old people waiting in the cold.
When did you arrive here this morning, Greg?
About 6. About 6 this morning.
Is that normal to line up at that time?
Yes, if you want to be seen, it's crazy. It's outrageous. Usually the lines to the road, just crazy.
This is what New Zealand's GP Crisis looks like in Ōtara, Auckland. Most of the people here have been lining up since around 6 a.m. Lining up because they say booking an appointment elsewhere means they'll have to wait weeks to get the care they need now. This clinic is unique. It allows walk-ins. But to be seen, you need to be up early. What time did you arrive this morning?
6:05. The reason I come early because I want to go see the doctor first, because if we come late, like 9 o'clock, that means I go home 3 o'clock.
Toa Salaina has back pain and is acutely aware of the pressures on general practice.
Because sometimes if we book the appointment, like we are enrolled from the other GP, they tell us if we ring and they say it's full, already booked the appointment. That's why we like to come here, because they open anytime until 11 o'clock. That's why we need the government to help the GP to add some more nurse and doctor for help the people.
And you've got a sore back and it's cold. That's not good for your sore back.
Yes, it's right. It's not good because my back is more pain because it's cold.
Should it be like this in New Zealand?
No, not at all. Not at all.
And have you been here before?
Twice a week, I come here on average.
And twice a week are you sitting out here in the cold in the early morning?
Yes, sure.
I feel like if there's anything that they can do, especially for our family doctors, I mean, they're our local doctors there who we go to when we're sick, when our kids are sick. So yeah, the wait time shouldn't be like this, and it's cold, so.
It's a difficult scene to take in for Lorenzo Kaisa, who's worked as the clinic's community liaison manager for the past 5 years.
The line just gets greater and greater, even in the cold, which breaks my heart, to see my people sitting out here. And you've seen majority of the people that are sitting out here in the cold before 7 o'clock are Māori and Pacific, which as the message that we want to send to the ministry or to Whatuora, that we need better health access, a better system to reduce what you've seen out here this morning.
You don't want to see your people in the cold,
they're already sick
and waiting.
They are already sick. They get, more unwell, sitting out here in the cold. This is something that I don't want my people to experience.
There's a sense of relief and urgency when the doors open just before 8 a.m. How bad is the situation at the moment for primary care, do you think, Lloyd?
Yeah, primary care is absolutely on its knees. We're seeing a number of clinics close throughout the country. We're seeing a number of general practitioners, just call it quits because it has got really hard. People are doing work in their own time, after hours, paperwork. The traffic doesn't stop, right? It's not like we can just shut the doors.
Lloyd McCann is the CEO of Tamaki Health, which owns the biggest network of GP clinics across the country, including this one. This practice is what's known as a VLC, or very low cost clinic. The idea is that certain clinics get extra funding, so access to healthcare for those most in need is improved. But when you're understaffed and overwhelmed, it doesn't really work. How long would people wait on average in here before they have not only seen the nurse but also the doctor and can actually clear out?
Yeah. So on a day like today, we probably are looking at 4.5, 5 hours.
He says scenes like this are due to chronic underfunding of the primary care sector.
This is a component of the sector that has unfortunately been underinvested in for a number of years, and I think we're paying the price for that now. Primary care, where it works well, will equal a healthy New Zealand, but we need more investment in this part of the sector.
So why does primary care matter? It's the first port of call to keep on top of your health. Regular visits mean issues are picked up earlier and you're less likely to end up in hospital. But GPs are under increasing pressure. People are living longer and coming in with multiple complex health issues. If you can't get a GP appointment or their books are closed, your next stop is likely to be hospital, leading to emergency departments being overloaded. It also contributes to what's known as ambulance ramping, as hospitals get overwhelmed with patients. Because hospitals are being overrun, patients are more frequently being discharged early, with GPs expected to manage them in the community. Add to that a dwindling workforce, with more GPs retiring or quitting due to burnout, and you have what most in the profession call a crisis.
So if we invest in primary care, what we'll probably see, in fact what we know we'll see, is savings downstream in the health system. So we'll take the pressure off hospitals. It's great to see the government, invested in cancer drugs, quite a big investment in cancer drugs. The challenge with that is, if we can't actually get people into the system, primary care being the front door of the system, all of the investment in the best cancer drugs in the world aren't actually going to make a difference to patients' outcomes.
Because it won't be picked up.
Correct.
How bad is it at the moment to be a GP?
It's really stressful with paperwork and patient overload, and we have 12 full-time GPs or urgent care doctors in the clinic, but still not enough, because as I mentioned before, we see 250 to 350 patients per day, but we still aren't meeting the demand because we have a lot of patients we have to turn away.
Dr. Nirashika regularly works extra hours due to staff shortages.
And even during my day off, I have to come and help. When they ask for help, I have to come. And for example, today is my day off, but my roster manager called me and asked if I can help the queue because there's not enough doctors.
Would you like to see more action from the government?
Of course.
Not enough doctor. Yeah. But the people is too many people.
For years, GPs have argued the way they are subsidised is broken, and government-commissioned reports support this. The matter's part of active discussions. Health New Zealand has proposed increasing the funding for GPs by 4%, but this has been roundly criticised as totally inadequate and disappointing.
I think this actually goes beyond just the minister. We as New Zealand need to decide to invest in primary care. We as New Zealanders need to demand more investment in primary care. 4% is not enough though, that's the bottom line. We need a substantive increase.
A substantive increase, so clinics aren't operating at a loss, so the profession can attract more GPs, and critically, so proper care can be delivered to patients and we can avoid scenes like this in Ōtara. How do you feel about that?
Yeah, it's heartbreaking. It's absolutely heartbreaking. you know, we don't want our patients, we don't want our communities experiencing this. It's gutting.